Oh, hi guys. This is Rachel Shoemate at Cornerstone Physical Therapy. I'm going to talk to you about some of the things that affect balance. And it's kind of a Pandora's box because there's so many things that can affect your balance just all the time. So I wanted to go ahead and just give you a couple of slides for PowerPoint so you don't hear me listing 10 million things. So first of all, one of the things that you want to look at is environmental factors. Do you want to change this one? There it goes. So environmental factors are kind of the things that are surrounding you that could trip you up or, cause you to be a little bit off balance or dizzy or anything like that. So the lighting in the house or wherever you are, you want to make sure that your hallways at your house are well lit. So adding things like little night lights in the hall or in the bathroom so you can see, so you don't trip over things like rugs or carpet. A lot of times we'll have, especially our older population, come in and trip over rugs and carpets that are like where the thresholds are in between the doors, or maybe you change wood floor over to the carpet and there's a little threshold there. So trying to mark that or make sure it's well lit is very helpful, especially with people that have poor balance. Pets, a lot of times we have people that say, hey, I fell when I was walking my dog, or I tripped over the bone that was in the floor. I have 3 dogs. I can't tell you how many times I step on bones or trip over dog toys or over the dog as we're trying to walk. So sometimes they're a hazard. And I see a fair amount of people that have issues for being knocked off balance with their pets. Crowded places, not really many people are at the mall right now, but in general, just trying to make sure people aren't bumping into you. Those are things that can knock people off balance. Or if it's more busy, like visually busy, sometimes it's hard to kind of get your foot placed in the right spot when you're walking and paying attention while you're turning and looking, maybe at the grocery store, and you see lots of things going by and there's lots of people. Slippery surfaces, of course. We've had plenty of rain around here. There's lots of mud. I know with hiking and over speed bumps or stepping up onto curbs thinking that you didn't make it all the way up and you had a flip-flop on or something and you tripped on the curb. And honestly, medication could kind of go into environmental factors or even into personal factors because it affects you internally. But medication-wise, one of the things that you need to understand is once you're on 4 medications, you're automatically considered a fall risk. And most people are on more than 4. So what happens is they start interacting with each other, and they can cause a lot of dizziness or lightheadedness, or you might feel weak, or maybe when you change positions, you just get a little off balance. So that's something to kind of pay attention to. Those are more environmental factors. Wrong direction. Sorry, guys. Okay, personal factors. Lots of people can have issues with blood pressure. So if your blood pressure fluctuates, whether or not it bottoms out, or increases too quickly, sometimes it can make you lightheaded and make you feel like you're going to pass out, especially if you go from lying down to sitting too quickly or from sitting to standing. Sometimes people just need a minute to take to get their blood pressure under control. Weakness is something that can affect your balance. Especially the more tired you get when you're walking, the more off balance you're going to be. Impaired judgment, that could be from any number of things. It could be from just not paying attention, like maybe looking at your phone while you're walking. It could be drug related, it could be because you're tired, you have an excessive amount of fatigue. That's another reason. Hydration, I see a lot of issues with. A lot of people will think that they just feel awful and then they're off balance and they're lightheaded, and it's a lot of times just because they're not drinking enough water. So the going recommendation now is to drink half of your weight in ounces of water, not like a gallon a day, which some people are encouraging right now, but half of your weight in ounces. And then if you exercise, of course, increase beyond that, up to like 2 to 4 cups beyond that, depending on your level of exercise. But joint pain, lots of people have knee pain, foot pain, hip pain. Any of that stuff can cause you to lose your balance. And then if you're walking with a really poor base of support, and so what I mean by that is if you're walking and your feet are really close together, like if you're doing the runway walk, I've had a lot of ladies coming in lately that walk and their feet are kind of scuffing together because they walk so close. Well, then they start teeter-tottering and they lose their balance with that. So not walking, like a duck with your feet out wide, but having space so you can see daylight between your legs when you walk is a very important thing just to keep your balance. as far as what makes up all of the things that help us with balance, we've got the vestibular system, and that's a whole other PowerPoint that we've got several people getting into, but that includes things like vertigo, Meniere's disease, which is not super common. You guys can look that up if you want. We get diagnoses of that a fair amount, but it's really not Meniere's disease a lot of the times. BPPV, that's just a fancy name for you become dizzy or lightheaded when you change positions. And so sometimes it's related to your inner ear, the little otoliths, the little crystals. If you had fallen and hit your head, sometimes that can be knocked off and you can get dizzy. Sometimes if you're in a car accident, they can get knocked loose and they'll make you dizzy with position change, or if you've had a concussion or anything like that. Sometimes BPPV can result from that, and you'll start to feel kind of like the room is spinning, but it's usually when you go from like lying on your back to side lying or to sitting and changing positions. So it's basically positionally related dizziness. Visual system, lighting, we talked about a little bit of that earlier, just making sure everything is well lit where you typically trip or fall. Depth perception, and then using glasses or just your normal vision. If your depth perception is off, then you're definitely going to have some issues with your balance. And progressive lenses, everybody is that's one of the more common lenses now that everybody's got. So you're going to have to change your head position, looking at your feet, kind of going up and down nonstop. And so sometimes that can make people dizzy. And it might be worth talking to your doctor about whether or not that's more beneficial if your balance is off. The other part is the somatosensory system. Basically, that's your joints and your proprioceptors. Fancy little word for they tell your body where it is in space. Kind of proprioception, just kind of where it is in space. A lot of people will come in, whether they have diabetes or they've got nerve injury or they're just older, they tend to have neuropathy. So they can't feel their feet very well and they lose their balance. So what happens is the visual system and the vestibular system has to come in and kind of help out with that. So with PT, some of the things that we do is we figure out which systems are working best for you, and then we try to complement that and kind of get you used to compensating as much as you can, or improve your balance as much as possible by finding your weaknesses and then addressing your weaknesses with PT-related exercises or stability or treatment. So that's some of the stuff that we do when it comes to balance, and these are the things that affect your balance. There's a lot going on there. We'll have a couple of other videos that have some balance tasks that you can start with, but this is just a little overview of how your balance can be affected. There's a lot. So I left you with the PowerPoint. Feel free to call us. You can schedule. If you've got questions, you can type them in the comments below. You can get our emails and all that information on our website. Thanks. Have a good day.